Good morning, everybody. Welcome to our TMC Mama Chat online. This morning, we're going to be talking about taboo mommy topics. And if you have any questions throughout the show or afterwards, go ahead and post those. We are not live today because our guest speaker is an evening RN here at TMC. So we are recording this early in the morning, and then we'll be airing it on Thursday, which is when you're viewing it now. So if you have questions, go ahead and post those to the comment box and we'll get back to those. I'm going to go ahead and bring on our guest speaker. Good morning, Rachel.
Good morning, Jordan. I'm Rachel. I'm a postpartum nurse here at TMC. I'm excited to talk to you all today, primarily because one of the favorite things I have about my job is teaching people and welcoming them into this new crazy world. And so being able to talk to you all today is pretty exciting.
It's very exciting. And you know, our motivation today in this conversation is just have a very transparent conversation to new moms or moms that are about to have their baby about what to expect immediately in the postpartum period, and then also just kind of in the first 2 months after you have baby. Yeah, so Rachel is also one of our instructors for childbirth education. She does infant CPR and baby care basics, or baby care ABCs. So thank you for being a wonderful nurse and educator for us here at Tucson Medical Center.
Yeah.
Let's go ahead and get started. So our topic today is taboo mommy topics. I think that this is a great conversation to open up for moms and partners and dads and families to kind of watch, because there's a lot of things we're going to talk about that might not come up before you have baby. You know, you're thinking about nursing, you're thinking about cuddling with your baby, and obviously the labor and delivery part of having a baby. But some of this postpartum stuff kind of doesn't cross your mind until you're there.
Right.
And so I think knowing a little bit about what to expect and being able to prepare and have conversations with your spouse or partner is a great way to go into this. So let's go ahead and get started. Tell us about the postpartum unit here and like the expected stay that mom might have over there before we get started.
So, of course, every family, every pair, mom and baby, is different. But in general, you'll spend between 2.5 hours in labor and delivery after you deliver your beautiful baby. And then you'll come on over postpartum, and you will get to stay with us. We will be privileged enough to have you for at least 24 hours so that your baby can receive their 24-hour labs and be cleared to go home by the pediatrician. That's for a vaginal delivery. Minimum stay is 24 hours. If you have a C-section, it'll be 48 hours. However, no one's going to shove you out the door if you need a little extra time, a little extra support, or there are any concerns from either of your physicians. Vaginal births can stay up to 48 hours and C-sections 4 days.
Right.
And of course, there are variations for everybody.
Exactly. That's just kind of our guideline. We don't really have like a particular hour where you're out the door, like you said. We want to make sure you're prepared, physically and mentally and ready to go home before you go.
Absolutely.
Okay. So the first thing we're going to talk about is, the belly after you deliver, what to expect with having baby. Like I just had, my 8-pound baby or my 6-pound baby,
Right.
and I still have this belly.
Yeah. So I think something I read online once that really stuck with me is that it took you 9 months to grow this beautiful baby. And so you need to give yourself some grace and some time. And part of that is that your uterus starts out the size of a walnut, essentially. And then it grows to accommodate this human that you have gloriously birthed. And it's a muscle. The uterus is a muscle. That's what you felt contracting and squeezing and pushing your baby as baby worked its way down. And so that muscle needs time to shrink. And the rest of your body also expanded to accommodate. You have skin and you have other tissue. You have adipose or fat tissue that spreads. And our bodies did this incredible, wonderful thing. So just giving yourself some time, hydrate, good nutrition, take care of yourself, and your body will take care of you.
Right. And then, with nursing, that helps the muscle, that uterus tighten back down. And then you guys are also doing checks to make sure that the uterus is doing its job right away to tighten down and help stop some of that bleeding. But really, the only immediate changes that will happen is
they call it a uterine massage, which I think can be a little misleading. But yeah, we do. We push on your uterus to ensure that it feels nice and hard and that it's shrinking, and that the amount of bleeding you're having is appropriate and doesn't cross any lines into a dangerous field.
Right. Okay, thank you. Let's go ahead and move to breast changes. So, obviously, just like your uterus is growing and changing during pregnancy, your breast tissue is changing and getting ready to make milk for your baby. Mm-hmm. So let's talk about like right after you deliver in the first, 48, 72 hours, sometimes up to a week, what's going on with the breast changes?
So I think something that worries women is they'll hear their friend or their mother or another woman say, oh, I started leaking at 4 months pregnant and I was collecting all this and my shirts were soaked. And it's important for women to know that that's not an indication of your abilities to successfully breastfeed. Some women will leak, some women will not. And that's okay. Either way, you will notice your breasts growing and changing. You'll also notice your areola becoming darker. One of the things we learn in baby care ABCs is that baby's sight is it's very black and white. They like colors that are drastically different. Mm-hmm. So your areola will get darker so that baby can better see and find your nipple for breastfeeding. You'll have colostrum for the first few days. Colostrum is super dense in nutrients and caloric value for your baby. So there's no worry that baby's not getting enough. We like to say that in the first 24 hours, 10 to 20 drops of colostrum is a full feeding. So that's good to know going in because your breasts will not instantly become full and drastically full of milk. Right. That'll take some time. And then after a while, that will reduce as your milk supply regulates. But keeping baby on the breast, lots of skin to skin. And then when you're done breastfeeding, your breasts, similarly to your belly, even if you choose not to breastfeed, your breasts will have grown in pregnancy. And they will have accommodated this milk to feed your beautiful baby, and they may look a little different, but they have done a great thing, a great service for your baby.
Yeah, and it takes time, after you're done breastfeeding for that tissue to kind of change back so that it's not producing milk or lactating. And those changes happen over time as well, like you said. It's not an overnight thing.
Yeah, there is no instant dry formula.
Right. And then, while we're talking about breast changes and nursing, I think it's important to know that you should expect leaking at some point if you're nursing, and having nursing pads available is great. A good nursing bra is something that I think moms should look into, or like a gown or something that's easy to nurse in, something that's comfortable and supportive for while you're nursing.
And some women find that finding nursing bras in their size or that fit them well is challenging. So just a quick tip is that you can have at most alteration shops a bra you already own altered to be a nursing bra. They add a strap and a clip, and it's also a cheaper alternative to buying an expensive nursing bra. If you have a bra you love that you're okay with being a nursing bra forever, then that's an option too.
Mm-hmm. And there's a lot of great like undershirts that you can wear that also function. They clip off of the front strap so that you can nurse easily, but still not be exposing your belly. That you're getting used to the changes with your belly. You can keep that covered with an undershirt. Okay. Are you ready to move on, or did you have any other comments about breast changes, things you wanted to mention?
I think that we should absolutely do an episode on breasts at some point if we haven't, but I think that's pretty good for today.
Yeah, we talked with two of our lactation consultants quite a bit about breastfeeding.
Oh, good. I need to look for that episode.
Yeah, but there's definitely, with breast changes, I think the idea of, you're in a store or in your car and you need to quickly breastfeed your baby before you run into a doctor's appointment, or you're at a doctor's appointment and you need to breastfeed, is finding that confidence and comfort to breastfeed in a public area is part of like the breast changes, I guess, not physically, but in your mind, how you think about your body and that you're a source of your body is to feed your baby. So think about it that way.
Yeah, I think also knowing the law, anywhere that mom is legally allowed to be, baby is legally allowed to breastfeed. So
Mhm.
just knowing that, because there are people who are uncomfortable with breastfeeding and they may request you to make a change about where you're breastfeeding, and that's not within their rights. It's within your right to feed your baby. So just to know that
Absolutely.
going into it, and maybe talk about to your partner or your other support people so that they can be a source of support if you find yourself in that situation,
Yeah.
into educating other people of your rights.
Great. That's great. Okay, let's move on. We're going to talk about restroom routine. This is definitely not something that is talked a ton about.
Right.
So, whether you are having a C-section or a vaginal delivery, obviously you're going to have some discharge, some of that lochia, and in that postpartum period, especially. And my postpartum nurse, when I had both my babies, was very helpful with, kind of telling me, showing me and teaching me what the routine was going to be or what the regimen was
Right.
going to be. So, can you talk with us a little bit about what we should expect postpartum for vaginal and C-section, and then what the regimen is going to be?
Absolutely. So, after the first time you go to the bathroom after you have your baby, if you have a vaginal delivery, if everything goes according to plan, you don't have any excess swelling, then the hope and reasonable expectation is that you should be able to use the bathroom after birth. So when your legs are feeling good, generally after you get over to postpartum, when you're on labor and delivery, they may help you with a straight cath. That'll depend on how numb you are. But on postpartum, you will always be helped to the bathroom the first 3 times. We want to make sure you don't fall. And we also want to teach you how to take care of yourself. So the first time in the bathroom, you'll sit on the toilet. We will fill a warm bottle with some warm water. We'll let you feel it. Some women like cooler water than others. And expect that your nurse will be close to you. She may kneel in front of you and spray your labia gently with the water. We are just gently washing away any of that lochia. Lochia is another word for blood. It's kind of period and tissuey. It's very, it's consistent with what you might have expected during a period prior to your pregnancy. We also don't want to create any more damage or discomfort to the tissue that's already probably pretty swollen and maybe a little uncomfortable. You might have a stitch or two. So we're not going to go rubbing and scrubbing with toilet paper. So instead, we're going to rinse with this nice gentle water, and we're going to pat dry with a washcloth. It feels different to people to think, oh, well, this is getting washed. Don't worry, there's a glorious wash routine for hospital linens. So you'll just pat dry with that. And we have ice packs. We have witch hazel pads, which really help. It's an astringent and really helps to reduce swelling on your labia. And it's also very cooling and comforting. There are ice packs and benzocaine spray. So benzocaine spray, some women love it. Some women are not big fans, but it's a numbing spray. It can be helpful after you pee if you're uncomfortable. Some women like to use it just before so that the acidity of their urine doesn't make their tissue feel uncomfortable.
Yeah, so you're going to have that pad, and then the witch hazel rounds on top of that, and then whether or not you're using the ice pack or the benzocaine spray, like you said, and then all of that is going to be inside of a glamorous pair of mesh panties, correct?
Beautiful mesh panties. The beautiful thing about mesh panties is that they can be thrown away. And we have an ample supply of them. You have no need to, quote unquote, ruin any of your good underwear. So mesh panties are fabulous because they fit from the smallest and slenderest of women to women with larger bodies, and they fit our pads. Pads are large. They've been described as feeling diaper-like. However, they accommodate the ice packs and the lochia that you're experiencing. It's all nicely contained and comfortable against your labia so that you can heal and not worry about laundry or anything else. They sit kind of high on the waist, so you're not worried about them falling down or going anywhere. And we're happy to send you home with extras because you can anticipate having some discharge and lochia for up to 6 weeks postpartum.
And I was going to say the spray bottle and these, the restroom routine that we're learning while we're here at the hospital, or moms are learning while they're here, they can take that home with them and use those same practices until those stitches are dissolved, until they're feeling like they're more comfortable using toilet paper and cleaning themselves off of the spray bottle.
And for women who might have a scheduled C-section or a C-section birth where they have not experienced much vaginal swelling or trauma, they may enjoy the spray bottle because it does help to feel cleaner when you've had lots of different fluids and tissues coming out of your body. Mm-hmm. If you are comfortable and you prefer toilet paper, move to that when you're ready, especially post C-section. But really just be gentle with your body no matter what kind of birth you experience.
And then I was going to ask about the hats that are in the toilet. Can you explain that to the moms so that they know, like, do I pee in that? Do I take that off of the toilet before I get in there? What is that for?
So the first 3 times you use the bathroom, we want to measure your pee. We want to measure a void, as we call it. So it's really important that your bladder, when it's filling, is in the way of your uterus. Your uterus is trying to shrink down, and your bladder, if it's full, is kind of in the way of that. So one way that we could make sure your uterus can do its job and close up shop is by making sure your bladder completely empties. So by measuring those first 3 voids, we're making sure that you're not only making urine and that you're adequately hydrated and able to pass urine, but that your bladder is completely emptying. Because if your bladder is not completely emptying and it's staying in the way of your uterus and your uterus can't quite close, we want to intervene and help those things happen so that you can continue your journey to healing. Mm-hmm. And so we measure your urine. We want there to be at least 300 cc's or milliliters of urine with each void for your first 3 postpartum. But of course, at any point, if it's a day or 2 or 3 or a week later, if you're not voiding or you're feeling as if your bladder is not completely emptying, definitely reach out to your provider so that they can help you out.
Thank you. And then something we didn't touch on that I thought of when you were talking about those mesh panties going up front, if you have had a C-section, you're going to have a dressing on the front, which that helps cover. And then also going back to the belly thing, just briefly, that the belly binder, we didn't talk about that. So, you're going to have the mesh panties, you're going to have the belly binder. Tell us.
Belly binders are for C-section moms. They're not for our vaginal deliveries because they're not needed. Mm-hmm. But for C-section deliveries, they went through your abdominal muscle to deliver your beautiful baby. And you use your muscles for a lot of things. And so when that tissue was cut and separated, you'll discover that when you laugh or cough or sneeze or do a lot of movement with your abdomen, it can be really uncomfortable. And so sometimes grabbing a pillow and holding it really close is helpful. But when you wear a belly binder, that pressure is consistent and you don't have to worry about quickly grabbing a pillow or moving your baby to hold something tight when someone tells you a funny joke.
Right.
So that the pressure provided by that belly binder is super comforting. If you don't like it, again, it's not something required, but it's really helpful in feeling more comfortable in moving and engaging in some of your regular activities as your abdominal muscles are healing.
Yeah, it definitely makes you feel more secure. And our rule was just no making me laugh. No laughing allowed.
As soon as you say that, though, someone will do it.
I know, exactly. Okay, so we're talking about everything getting back to normal. We talked about restroom routine. So let's talk about that period after you've gotten home and everything's healing. You might have had some stitches. You might have had a C-section and everything's kind of getting back to normal. And while that's happening, your doctor is going to place you on pelvic rest. Can you tell us a little bit about what is pelvic rest, how long does it last, and why pelvic rest?
So the reason that you are wearing these big pads in your underwear postpartum and you're not using tampons or menstrual cups or other internal methods of collecting that fluid is because you're on pelvic rest. It's incredibly important that you do not put anything in your vagina for the first 6 weeks. That includes your partner's penis. That includes any sexual toys or objects. It includes tampons, menstrual cups, absolutely no douching. And that's because your uterus, which we've talked a lot about, has a giant dinner plate size wound on the inside. Your placenta was attached to your uterus, and after your baby was born, your placenta was delivered. Your placenta is delivered, and all the places it was attached on the inside are now a wound. That's part of what's bleeding. And so your cervix opened to accommodate your baby's exit. And so your vagina has now become a straight path for pathogens, germs, bacteria, to this open wound on the inside of your body. And it is so important that we keep you safe and free of illness. And that absolutely includes this direct pathway to an open wound. So 6 weeks of pelvic rest, that's the nothing in the vagina for 6 weeks, is not just because your doctor wants you to rest. It's not just because they don't want you getting pregnant right away or anything else. It's because you have this wound that's naturally occurring, but that is an open invitation to pathogens, bacteria, and illness, and we want to keep you safe.
Right. You don't want an infection while you're at home trying to nurse baby and get yourself adjusted to your new home. You
don't want to be readmitted to the hospital. As much as we love seeing you and love taking care of you and teaching about you and your baby, you want to be home comfortable in your bed and not back with us on antibiotics. Not the way you want to go with that.
Right. And then sometimes, even if you're on pelvic rest after 6 weeks and, you might get the clear for, pelvic rest is over. Some women obviously might choose to wait longer because you might have had an episiotomy or a tear or something that,
and
you're just not ready.
You might just not feel it. There's such a huge hormonal shift postpartum also. And you may just need more time to be comfortable in your body and to and so having your partner's support and respect in that as you move towards your new normal is important to talk about in advance. I think sometimes partners hear, 6 weeks, all right, it's been 6 weeks. Well, that's just it's safe, not the I'm ready.
Right. And so, going into having an open conversation about these things with your partner or your spouse or your support system, I think it's important that we go before you have a baby, you're talking about some of these things, which is why we think it's so important to have a transparent conversation so you know about these topics, but also figuring out what you expect before you go in. And then after you have baby, are those expectations still there? Have they changed? Having those conversations and knowing your limits, knowing your body, knowing where you are emotionally, realizing all the different things that you're going to have to do to take care of baby, take care of yourself, which is your primary job. For the first, they say 2 to 3 weeks, but really 4 to 6 weeks here, or quite a while. So knowing your limits and making sure that you express those to your support team. Not making sure you're not feeling like you have to do all the laundry, you have to vacuum the house, you're making all the meals, you're doing all the dishes, because that can lead to an increase in your bleeding if you're not resting, correct? Yeah.
Absolutely.
And so, making sure you know your limits and you're having these conversations is important, and that you continue to have them, and that your spouse speaks up about their expectations.
Right.
Along the way, so you guys are communicating, because it's a wonderful time, but it's also can be a stressful time. So communication is very important.
Yep. Yeah, I would say from the beginning, even after listening to this StreamYard here, if you talk to your partner, what do you envision for yourself postpartum, and even in labor and delivery, and what does your partner envision? Because one of you might envision this big celebration while you're delivering with grandparents and siblings. And another one of you might envision the delivering person and the partner quietly together, engaging in this new life that you've invited. And that might change. You might I know that I had a friend who was adamant, I don't want anyone there. And she got to 8 or 9 centimeters and said, man, I really want my mom here.
Yeah.
And thankfully, she talked to her partner, and her partner reached out to her mom and made that happen, because things do change. But it was important they had that conversation, because you want to figure out kind of in advance, but it goes beyond the delivery room, of course, and it goes beyond the postpartum in the hospital, but to when you get home, because so many people want to meet your new baby and they're so excited for you and they want to support you and love you. And even coming up with now a short list of things when someone comes over, I think these are some things that might be helpful, because people come over and they want to help. Yes, of course they want to see your baby and they would love to snuggle your baby if it works for you. But sometimes they just want to feel helpful. So having a list, like if you could empty the dishwasher for me, or bring me a freezer meal that I could throw in the crock pot when I'm hungry and I'm breastfeeding and I'm exhausted.
Absolutely.
Having that ready so that people can engage with you, and you've already kind of set that limit of, I would love your help. Here's how you can help. And it might not always involve people. If there's someone who says they just want to come and snuggle your baby, it's okay for them to want that. And it's okay for you to say this isn't a good time. That doesn't make you a bad friend or a bad family member. It just means that you're setting a limit and what you need. And you might not want a bunch of people around when you have your lochia and your mesh panties and your leaking breasts. And sometimes you just want some privacy, and that's okay too.
Absolutely. And it's okay to take a minute to yourself if you want to take a quick shower, or you need to, go sit outside for a couple of minutes and get fresh air. It's important and it's healthy to get in touch with yourself when all this stuff is going on. Yeah. And remember to enjoy it.
Yes.
Even all the crazy things you're talking about. Exactly. So take the help when people offer it. Well, Rachel, thank you so much for coming to talk with us today. And I appreciate all your expertise and your heart. Thank you so much.
Thank you.
All right, everybody. So next week, we are going to be having some experts on to talk about hot car safety. That will be next Thursday, June 22nd at 11 a.m. Thank you so much for joining us today. And if you have questions, you can post those on here, or you can contact me. I'd be happy to talk with you over the phone about these topics, or getting you in touch with some of our instructors for our classes. Have a great day.